again, just in terms of the timeline, on the 9th of April, there was an update. With immediate effect, all intensive care and general hospital visiting across Northern Ireland has now stopped.
Yeah.
And then, although palliative care outside of intensive care was listed as an exception, there was no exception for those patients receiving end-of-life care within intensive care units.
Yeah.
Why was that decision taken on the 9th of April to stop all intensive care visiting?
I deeply regret that we had to make that decision, but we were in the peak of the first wave. We were expanding our capacity for ICU. We had additional ICU beds in most intensive care units, some of which had limited space. And you will appreciate that an intensive care bed comes with both a lot of kit and a lot of staffing requirements. And it wasn't possible in a high-risk area with aerosol-generating procedures and the implications of donning and doffing to enable staff to allow visitors in through the donning and doffing process to be extra people in an already very confined space, and when our staff were extremely stretched at that point in order to provide direct care. So for that period of time during that first wave, we had to further restrict visiting, and we reverted to virtual visiting at that point. I felt at the time we were between a rock and a hard place. There was nowhere else to go with this. It wasn't a decision that I either wanted to make or would want anybody's family to have experienced. But it was a balance of risk between protecting patients, staff and the public. And I really do understand the implications of making that decision. I've had very personal experience not being able to visit my own mother when she died in hospital. So I do understand.